It is not enough for you to avoid alcohol when pregnant, but you should also take your prenatal vitamins seriously to have a healthy baby. This is Everything Woman by Ella, and today we are talking about prenatal vitamins, everything that you need to know. So let's go straight to the point. What are prenatal vitamins? Prenatal vitamins are vitamin supplements made for pregnant women or women who are trying to get pregnant. They are fortified with the main nutrients, the main vitamins and minerals that the baby needs in the womb. Now, what does that mean? It means that if you want to get pregnant or you are pregnant, then you should take your prenatal vitamins. So let's say you want to get pregnant in the next 3 months or in the next 1 month, start taking your prenatal vitamins. What prenatal vitamin does is that it prepares your body, it gives your body everything that your baby needs once you get pregnant. You know that as a woman, you don't exactly know the minute you get pregnant. Many times before we discover we are pregnant, to be like a week, 2 weeks, or several weeks after pregnancy. But whether you know it immediately or not, your baby is going to need those essential nutrients to develop, especially in the early stages of pregnancy. The most delicate stage of pregnancy is the first 12 weeks. During that time, important and vital organs in your baby starts to develop. And if anything goes wrong, the child can have brain or spinal defects that can affect the child later in life. So that is why it is important to prepare your body. And one of the easiest way to prepare your body for pregnancy is by taking prenatal vitamins. But you also need to understand that prenatal vitamins do not cause conception, meaning that taking prenatal vitamins is not going to make up for any STIs, UTIs, or any fertility issues that you may have. So before you start your prenatal vitamin journey, it is advisable to consult your doctor if you have any concerns concerning your conception before you get pregnant. So that is what it does. So if you're already pregnant, is it too late to start your prenatal vitamins? Of course not. The moment you discover that you are pregnant, start taking your vitamins immediately because your baby needs it. Now, you might be thinking, okay, I eat very well, I eat good food, and I don't need the prenatal vitamins. Of course, eating well can never be understated. Prenatal vitamins can never make up for a good and balanced nutrition. However, all the foods you eat may not give you everything you need. The food you eat may lack certain nutrients that your baby needs, especially folate. Prenatal vitamins are fortified with folic acid. And folic acid is very important for spine and brain development. So take it. Take it very seriously, especially in the first trimester when all the vital organs are still developing. Very importantly, your doctor should be the one to administer your prenatal vitamins to you. Prenatal vitamins can easily be gotten over the counter. So it is tempting, it's very easy. You don't need prescription. You can just go over the counter to get your prenatal vitamins. But your doctor may need to do blood work and take the history, your pregnancy history or your health history, to be able to give you the proper prenatal vitamin that your body needs. Now, some persons may have suffered from anemia, or some persons may have had pregnancies that were sickle cell, that the babies were sickle cell. If you've had that, your doctor is going to prescribe probably higher doses of prenatal vitamins because you may be lacking iron and some other nutrients, so that this pregnancy doesn't give you as much stress as your previous pregnancies. Also, when you meet a doctor, he can get your history on allergies. Some prenatal vitamins have soy oil, and some people may be allergic to soy oil. So if you have those allergies, could be soy oil, it could be any other food allergy. If you tell your doctor is going to get the proper prenatal vitamins that's good for you so that the side effects will not be too severe. Because when you start taking prenatal vitamins at first, you might have side effects like nausea, vomiting, and what have you. But when you tell your doctor some of these issues that you may or may not have, then he knows what to give to you. And when he prescribes it to you, there will be a follow up. Do not overstate the importance of a follow up during pregnancy. Your first pregnancy and your second pregnancies are different. Each pregnancy have a unique journey. So don't just say, oh, I've given birth before, I've had the experience, I don't need follow up. You lie, you need it. Each pregnancy is different. Now, just because prenatal vitamins are important doesn't mean you should stuff yourself with them. And that is why you need to go to the doctor. Because some persons now may hear and say, oh, okay, you know what? I'm going to be taking folic acid. I'm going to take prenatal vitamins. Then I'm going to take my normal vitamin supplement that I was having, that I was taking before pregnancy, so that my child will be well and fortified with the basic nutrients that he needs. You know that too much of everything is bad. If you give your body too much vitamins than that it needs, it will affect your baby negatively. Your baby may have slow brain development, and your baby may become insulin resistant and can increase their chances of having diabetes. So do not overdo it. And that is why getting a doctor to prescribe your prenatal vitamins that are suitable for you is important, because some prenatal vitamins have high level of folic acid. So if you have that prenatal vitamins that is just okay without anything else, and you take extra folic acid, it can affect your baby negatively. But there are some prenatal vitamins that you need to add folic acid to fortify its strength, but you don't know it. That is where a doctor comes in. Also, if you take prenatal vitamins, should you calm down on eating healthy? No. The thing is, when you eat healthy, it is almost impossible for you to overdo the nutrients. You can overdo the nutrients with supplements, but overdoing the nutrients with a healthy food is very difficult. So even with your prenatal vitamins, make sure that you eat foods that are safe for your baby and that your baby needs. For instance, mangoes. Mangoes are very good for pregnant women, and they contain good levels of folic acid, which is folate. The natural form is folate. They contain high levels of folate. So eating mangoes, avocados, nuts, fruits like oranges will help your baby during the pregnancy process. What happens when you cannot take your prenatal vitamins because of certain reasons? Now, I understand that some people may not be able to afford it. I also understand that some people may not be able to keep it down, like everything that goes in goes out. If you know you can't take your prenatal vitamins for some reason, then it is advisable to talk to your doctor. And if you can't take your prenatal vitamins due to some certain reasons, then you need to take healthy eating very, very serious. And of course, the general rule before you make any major decision concerning your pregnancy, concerning your baby, always consult with your doctor. Please like this video, comment, and subscribe for more. Stay safe, love yourself, and I'll see you soon. Bye.